Hello all, today we are going to discuss about osteomalacia. I am Mrs. Golden, working as tutor in M College of Nursing. So the objectives are, at the end of the class we will be able to discuss about introduction to osteomalacia, define osteomalacia, what are the causes, pathophysiology, risk factors, clinical manifestations, diagnostic methods and management of osteomalacia. Introduction. Osteo means bone, malacia means the abnormal softening. So the resorption of calcium from the bone, which can be caused due to the increased level of parathyroid hormone, that is the hyperparathyroidism, which leads to hypercalcemia. So osteomalacia is a generalized bone condition where the inadequate mineralization of bone occurs. So in children, the osteomalacia is referred as rickets. In adult, we call it as osteomalacia. It is most commonly caused due to vitamin D deficiency. Definition. Osteomalacia is the softening of the bones caused by defective bone mineralization, which is a secondary cause due to the inadequate levels of phosphate and calcium. So osteomalacia is defined as the failure of the organic bone matrix where the bones doesn't mineralize properly, which results in soft and weak bones in the adults. So sunlight is a very important source of vitamin D. So adequate supplies of vitamin D can only be synthesized through sufficient exposure in the sunlight. So sunlight exposure is very important for the production of vitamin D. Causes. So the important causes are the vitamin D deficiency. So vitamin D deficiency occurs due to inadequate sunlight exposure or poor diet intake, or if there is any malabsorption like in conditions like Crohn's disease and celiac disease. And one more cause is the impaired vitamin D metabolism. So this occurs in conditions like liver disorders, that is cirrhosis of the liver, and in kidney disorders like renal failure. Other causes are phosphate depletion, medications like anticonvulsants, and chronic alcoholism. So moving on to the pathophysiology. So it mainly caused due to the low vitamin D. So when there is inadequate levels of vitamin D, it leads to decreased calcium and phosphate absorption, which further leads to decreased calcium level, that is the hypocalcemia. So when there is hypocalcemia, the parathyroid hormone increases. So when there is an increase in the PTH hormone, that is the parathyroid hormone, there is an increased bone resorption. So adequately, bone mineralization will be failed, which leads to soft, weak bones, which is prone for fractures. Risk factors. Elderly population, people with inadequate sunlight exposure, vegetarians, which leads to low vitamin D intake, pregnant and lactating women, chronic kidney or liver diseases. So coming on to the clinical manifestations. So the clinical manifestations are bone pain, especially in the hips, lower back, ribs and legs. Muscle weakness will be there, which leads to difficulty in walking, waggling gait, bone tenderness on pressure, fatigue and reduced physical endurance. And other pathological fractures may also occur due to muscle spasms, that is tetany, and difficulty in climbing stairs or rising from chair, or some of the clinical manifestations for osteomalacia. So coming on to the diagnostic measures. So one of the most important diagnostic measures are the X-ray. So the X-ray, the imaging pictures have been given and displayed. So coming on to the lab investigations, serum calcium, serum phosphate, serum vitamin D, alkaline phosphatase, parathyroid hormone, X-rays. So X-ray images have been displayed in the previous slide, bone biopsy. So moving on to the management. The medical management are vitamin D supplementation, that is cholecalciferol, which is an important vitamin D3 supplement, calcitrol in renal failure patients, calcium supplements, that is the calcium carbonate, phosphate supplements can be taken if there is a deficiency in phosphate level, and treating underlying conditions like kidney or liver diseases are some of the medical management for osteomalacia. So the dietary sources for osteomalacia are milk and dairy products is very essential for this condition. Eggs, fortified cereals, fish like salmon, sardines and mackerel, green leafy vegetables, and sunlight exposure for up to minimum 15 to 30 minutes is recommended. Moving on to the nursing interventions, provide pain relief, encourage diet rich in calcium and vitamin D, educate the patient on sunlight exposure for vitamin D3 exposure, assist with the mobility and fall prevention, administer medications and supplements if prescribed, provide psychological support to the patients, monitor laboratory values, health education on avoid alcohol and smoking should be given, continue the lifelong calcium supplements if the chronic cause exists. Complications, frequent fractures, permanent bone deformities, and reduced mobility and disability are some of the complications for osteomalacia. Thank you all.